nurse practitioner and clinic director here at Illumma. So let's talk about the ketamine experience and how to prepare. One of the most important parts of your journey is going to be set and setting. What does that mean? So set is going to be your mindset. So set are things like mantras or intentions. A few mantras to give some examples would be here now, I'm open to healing, I am ready to learn, or an hour for myself. Intentions can be a purpose or an internal alignment that we're trying to connect to. We're going to actually ask you your intention before each session. You'll be able to write it down. And so it's important to kind of come up with these beforehand. So some examples are, what is motivating you to get better? What are you hoping to get out of the session? What are some areas that maybe you desire to heal during this process? What areas do you maybe need clarity? Start working through these questions and focus on more of an area to create an intention around. So that's your set, your mindset. And then your setting is what we, Illumma, will provide for you throughout your session. So we'll do our best to provide a very safe, calm, warm environment. We will give you things like eye shades to put on. These will go over your eyes, of course, to help focus on internal things and not be so distracted by being able to open your eyes and see things externally. We'll also give you some music and some noise canceling headphones. If you're doing our KAT route, you may have a fun speaker in the room with you from your therapist, but that will help create a deeper, sometimes more profound emotional experience by using music. We do have playlists that we recommend. So for your first few sessions, maybe consider seeing what type of music we recommend. We want it to be something you're not familiar with and something that doesn't have lyrics. And so we'll provide that for you for each session. Bring some comfort items. Things to help you feel relaxed. So whether it's a stuffed animal, some fuzzy socks, a blanket, a pillow, we'll provide, if you need some pillows, we'll provide some blankets and weighted blankets if you'd like. So we do have those as an option for you as well. So you've got your setting, that's the first part. A common question we get is, what will I feel during the session? Great question. A lot of times people will say that their tongue feels heavy. They may have a desire to talk, but many of our patients choose to go inward and refrain from talking. Some people say they feel very consciously aware, but become less aware of their physical surroundings. Next thing would be, what do I expect in the long run of using ketamine sessions? You may start to look at situations differently. You may start to acknowledge emotions that you've had about past situations, or maybe some repressed emotions that we put on the back burner because it's too much to deal with at that time. You may start to put pieces together. You may find forgiveness. You may find peace or self-love. You may even find some more negative emotions that may be more difficult to process, like anger, grief, or feelings of just wanting to be done with it. All of these are normal emotions to have throughout your sessions. And some people may even notice some old forgotten traumas. So again, this is why we focus on providing you support throughout your sessions. We can give you a therapist, a coach to work with, or even offer integration sessions as well to help process throughout your journey. Sometimes people will say or feel that they're confronting a new reality, or that they're readjusting roles. They may explore new identities. You may understand your consciousness a little bit more. Some people have some really beautiful and profound spiritual experiences as well. So it's kind of about the session. And then after the session, what do we do? What does Illumma recommend? We recommend don't go back to work. Take the time for yourself, nourish yourself. So go eat some good food, go drink some water, some electrolytes. We offer IV vitamins and NAD infusions as well after your session to help recovery, to help kind of replenish things that we're often deficient in. It's really important after your session to avoid social media, to avoid news and current events. Those can be stressful, they can be distracting, and that's not what we want to put back into our brains after it's creating new pathways. Listen to your body. So if you need rest, please go take time to rest. If you feel like going for a walk outside, enjoy your time outside with that extra energy you have. Journal, relax, meditate, maybe make some art, music, listen to what you need. Negative self-talk or that negative narrative may kick back up again. keep in mind there is no right way to feel as you go throughout this journey. It may be a day, it may be months until you see change. And after a ketamine session, keep in mind that your brain is like wet cement. So now's the time for new changes, being open to new perspectives, even if they're kind of eye-rolling. Try different things. Curiosity about what's going on in your mind can be very helpful as well. I'm going to read you a quote by Dr. Stephen Levine. He was a ketamine infusion pioneer and psychiatrist, and he states that even a magic bullet leaves a wound that requires a period of recovery. And that key component to this recovery, so things that are needed in that recovery, are social support and ongoing therapy. So while ketamine is a really powerful and beautiful tool in your toolbox, it's really important to have other tools as well. We are here to support you throughout your journey, and we'll check in frequently throughout your sessions to see how you're doing and what else you may need. And again, your nurse practitioner will go over all of this information in your consultation, so you have time to ask questions, get more specifics about things. But ultimately, we look forward to working with you on your journey, and we can't wait to see you connect back with your inner light.